audit system so that we may not obstruct the views of others. So on this note, I would like us to observe individual silent prayer, please. Amen and Amen. As usual, see recorder, please. Let's do it fast. As usual, we'd like to begin this press briefing with the weekly updates, and that will be followed by introduction of our key speakers, chaired by the Deputy Minister of Information and Communication. We begin with the update. Parliament yesterday debated and approved a $55 million grant for the construction of a fish harbour at Black Johnson. Members of Parliament unanimously approved the grant and cautioned the Honourable Minister of Fisheries and Marine Resources to take into cognizance all social and environmental preventive measures from the operational area and the community. The Minister of Fisheries and Marine Resources, Honourable Emma Kuwajalo, stated that the construction of a fish harbour will bring sanity to the fishing sector and it will greatly contribute to the country's GDP. The United Nations Partnership on the Rights of Persons with Disability, country team in collaboration with the Ministry of Social Welfare, has ended a 5-day induction workshop on at Family Kingdom Resort that was aimed at issues that borders on the rights of persons with disability in the country. The Honourable Minister, Madam Bindu Dasama Kamara, disclosed that the workshop was a joint expression of interest in outlining issues of persons with disability, as it was a joint expression that presented a huge opportunity to persons with disability, which is an integral component of the United Nations global response to developmental issues. The Minister of Technical and Higher Education, Professor Alpha T. Wuri, has held discussions with the administrative staff and students of Jala University at the university's auditorium, Jala campus. His engagement was aimed at entreating the administration to heighten its staff capacity and quality of outputs, with much premium on the core sciences for which the university was originally created, as well as presenting teaching and learning materials for the university. Sierra Leone's Minister of Planning and Economic Development, Dr. Francis Kaikai, has in a virtual meeting informed the annual investment meeting organized by the United Arab Emirates, UAE, that Sierra Leone is an enabling environment and a reliable destination for investment. With the theme, Africa Unlocked, Innovation and Sustainability as Drivers of Economic Growth, the 2-day virtual conference seeks to explore the developmental potential of the African continent and highlight its huge opportunities that can serve as key sources of economic progress, not only for the region, but for the world. And lastly, the Director General of Human Resource Management Office, Mr. Ansu Samuel Toka, has concluded his administrative tour in 3 districts, including Falaba, Kwenadugu, and Karine. Civil servants in the 3 districts have described the Director General as a visionary and committed authority who is determined to transform the Sierra Leone civil service as an effective and efficient service delivery entity. The outreach was established to direct established as a direct line of communication with civil servants nationwide, with a view to educating them on the ongoing reforms and efforts of government of Sierra Leone in improving service delivery, identify the challenges civil servants are faced with in discharging their duties, and to enable the HRMO to find solutions to those challenges for improved service delivery. And that ends our update for this week. And for the rest of the briefing, we'll take you now through with the Deputy Minister of Information and Communications, Mr. Solomon Jamil, who will introduce the speakers present and discussions for today. Thank you very much.
Thank you, Mr. Ture, for forerunning this. I take the opportunity to welcome all of us and ask us, as our usual public health advisory, please fully mask up. Thank you. So we have with us today the distinguished Deputy Minister for Gender and Children's Affairs, Hindo Wabindi, as well as Frank Williams, the second in command for NACOVAC Operations Pillar, and I'm sure he is doing so much of the heavy lifting in trying to enforce the measures as announced by His Excellency the President on 1st July. So he will be talking to us about the scope of operations as it is and some of the technological features that we're lending to the COVID-19 enforcement process. So we have these two distinguished gentlemen with us. I will do a joint presentation with Frank. I will do the forerunning with some basic data as to where we are. And after that, Frank Williams will talk to us about the scope of operations. But first, I wish to give the floor to my distinguished friend and brother, Hindo Wabindi, to Deputy Minister of Gender and Children's Affairs, to talk to us about Cluster 5 of the Medium-Term National Development Plan. And we know the ministry is currently working on the Gender Empowerment Equality Bill, and which seems to be a very proactive step. But let me give the floor to our Deputy Minister to talk to us about Cluster 5 and any other issue he considers very material under the circumstances. Mr. Bindi.
Mr. Chairman, the Honorable Deputy Minister of Information and Communication, members of the Ministry of Information and Communication, the Director of Gender, Ministry of Gender and Children's Affairs, distinguished members of the First Lady, ladies and gentlemen, good afternoon. Like the Honorable Deputy Minister did say, who happens to be the chairman, so I'm here on behalf of the Ministry of Gender and Children's Affairs to come and give an update of the activities of the Ministry of Gender and Children's Affairs. It's going to be a PowerPoint presentation, and as you can see, the Ministry of Gender and Children's Affairs is tasked with the following. So lead the development, implementation, and monitoring of policy and legal framework of issues relating to women and children below 18 years of age. We lead on development and monitoring of policies related to gender and children's issues. Take necessary actions to achieve full participation of women in development. We address issues of violence against women and children. We liaise with development agencies, NGOs, for addressing the needs of women and children. We collaborate with the relevant ministries, departments, and agencies working on gender and children's issues. That is why we're here today on the weekly press briefing, the Ministry of Information and Communication. We mobilize resources in support of gender and children-related projects. We also ensure the gender and children responsive national development frameworks are being done across the board. Like every other ministry, in line with the new direction of His Excellency the President, Brigadier Retired Dr. Jesus Madadio, we have a vision as a ministry. Our vision is to have a society free from violence and discrimination, and where the fundamental rights of women and children are respected and cherished. The Ministry of Gender and Children's Affairs principally provides leadership for Cluster 5 of empowering women and children, as indicated in 5.1 and 2 respectively. And in that very cluster we're talking about, there are two policies and objectives. 5.1, to promote the overall empowerment of women in political, social and cultural spheres. 5.2, to ensure a child-first approach for survival, protection and development of children, including disabled and vulnerable children, prioritizing the best interest of children at all times. With special focuses, we launch during the slide before this. One more. Okay, 5.2, like I was saying, to ensure a child-first approach for survival, protection, development of children, including disabled and vulnerable children. When prioritizing the best interests of the child at all times, with special focus is addressing sexual violence, teenage pregnancy, child marriage, orphan and vulnerable children, child trafficking, child labor, and juvenile justice. With us, the government of Sierra Leone has revised and strengthened the Sexual Offences Act of 2012, and now the Sexual Offences Act amended 2019, with robust penalties and operational mechanisms put in place for implementation, including but not limited to medical examination, treatment and reports. We have set up the 116 hotline on sexual and gender-based violence, setting up of 6 OneStop Centers in Kiama Road Hospital, Boloko, Koinadugu, Kailahun, Moyamba, and Pujam districts. The establishment of the Sexual Offences Model Court within the jurisdiction, amongst others. All these measures are put in place to provide holistic service and fast-tracking justice delivery system. The Child Rights Act of 2007 is currently under review as approved by Cabinet. The process is expected to be concluded before the end of this year. It will, among other things, address harmonization of age marriage, expand harmful practices to include female genital mutilations, FGM, amongst others. The Adoption Act of 1989. The Adoption Act of 1989 has been revised in 2010, but was not conclusive. Upon the division of the Ministry of Gender and Children's Affairs from its parent Ministry of Social Welfare, the Ministry and its partners are now at advanced stage to review the enactment of the Gender Bill of 2021, and which is expected to be concluded also by the end of the year. It will incorporate also the Hague Convention and all the best practices when it talks about adoption across the board. As a ministry, of course, its name depicts itself, the Ministry of Gender and Children's Affairs. We are dealing with the Gender Equality and Women's Empowerment Bill of 2021. Our ministry and its partners are at advanced stage in development of the Gender Bill, Equality Bill. This bill will include political empowerment, both appointive and elective, economic empowerment through across the finance, especially on credit, empowerment among others, Once Cabinet approves this bill, the due process will be followed on it to be tabled in Parliament for an enactment. This will make a huge shift in the empowerment of women and men in Sierra Leone. It is expected to be concluded before the end of this year. We also have the Gender Equality and Women's Empowerment Policy. The government of Sierra Leone has adopted one of the progressive policies for the promotion of gender equality and empowerment of women around the world. The policy was officially launched by His Excellency the President, Brigadier Retired Dr. Jesus Madabdio, on the 3rd of December 2020 for its full implementation. The policy has been rolled out across the country and copies disseminated to all stakeholders for implementation. The ministry further organized National Women's Conference to share policies and develop a work plan for its implementation. The slides will go very fast now because these are the activities that we are undertaking by the ministry, the International Women's Day, when we run the entrepreneurship, financial literacy training of the Beawa project beneficiaries. Then we'll come to this project later because this was a project that was done in both districts and which had over 200 women beneficiaries across along the line. We'll come to it. Let's go, please. You can see it was at a location at the OneStop Center. Yes, this one is, remember when I was doing my presentation, I spoke about the OneStop Center, wherein when sexually gender-based violence incidents are taking place for treatment. You can see the team of MOGCA handing over materials to the manager in Kailan, one of our OneStop Centers. The strategies of our ministry. As you all know, the Ministry of Gender and Children's Affairs, the National Male Involvement Strategy for Sexual Gender-Based Violence Prevention 2020, the SGBV, the Ministry of Gender and Children's Affairs in collaboration with partners developed a strategy to address sexual gender-based violence and was officially launched by His Excellency the President, again on the International Day of Women on the 8th of March 2020 in Gambia. Our national strategy also for SGB response 2021. I beg your pardon. The ministry has finalized a draft of the strategy and ready for printing and dissemination in the shortest possible time. Our Street Child Strategy 2021, which is also very, very much paramount to the ministry. Our Honorable Minister, she's very, very much passionate about this because when we talk about children, we are not just limiting ourselves to school-going kids. But when you say street children, of course, His Excellency the President also is very, very much passionate when he's talking about children, street children. So we have designed, we're working on the policy at that level, which is the National Street Children Strategy, which the Ministry has finalized draft of the strategy and ready for printing and dissemination within the shortest possible time. Plans as a ministry in line with the medium-term plan of the government of Sierra Leone. We're working on the National Agenda Strategic Plan for 2019 to 2023. The government has developed the National Agenda Strategic Plan as aligned to the Mid-Term National Development Plan. With the establishment of the Ministry of Gender and Children's Affairs, we are currently working on the development of the strategic plan for the entire ministry that will cover gender and children's affairs. You know, our government and other development partners have signed other MOUs at other various levels. So at this stage, we are looking at the Sierra Leone National Action Plan for the United Nations Security Council Resolution 1325 and 1820. Sierra Leone as a member to the UN, as part of its Security Council resolution, the United Nations Security Council Resolution 1325 on women, peace and security was adopted in 2020, and its sister resolution in 1820 on sexual violence in 2008. Member states were encouraged to develop national action plan for its implementation. Sierra Leone developed its first national plan in 2010, and the plan elapsed in 2014. The government has developed the second generation of the National Action Plan from 2019 to 2023. Thus, in the crafting process, which promotes a culture of ownership and sustainability, which include based in one country. Demands and priorities, the matters of prosecution of perpetrators of violence against women, community engagement and coordination, undoubtedly, the agreed pillar of SleepNap 2 will go a long way in addressing violence against women and ensuring inclusive participation and empowerment for women. We're also talking about the National Referral Protocol on Gender-Based Violence 2012. The National Referral Protocol on Gender-Based Violence is currently undergoing review to include school-related gender-based violence. We are collaborating with the Ministry of Basic and Senior Secondary School Education on this particular one. The women's empowerment, which is also another key pillar to us as a ministry. The Women's Empowerment Fund for Female Entrepreneurs, the ministry has developed concepts notes on the Women's Empowerment Fund, which has been submitted to the Ministry of Finance through the Ministry of Economic and Development Planning for funding. The government of Sierra Leone, with support from the Spanish aid, NEPAD, through ECOWAS, has concluded the implementation of a pilot project called the Business Incubator for Africa Women's Entrepreneurship, BAWA, which earlier I spoke of, in Bo District, covering 6 chiefdoms in that district, with 200 beneficiaries. Ladies and gentlemen, Mr. Chairman, the Honorable Deputy Minister of Information and Communication, the Director. This presentation is a PowerPoint presentation. I am here with the Director of Gender. We're here to explain to the country, the general people, what the Ministry of Gender and Children's Affairs have been doing over the period. And we're here available for questions on two folds. When it comes on policies, we at the leadership level, I'll be here. And when it comes to the technical aspect of it, I am here with Director Charles Vandy. He is also willing and available. On that note, before I ascend this assembly team, so I'm Chairman, I want to say thank you very much for coming and giving us an audience as a ministry. To the press, we are always open up as a ministry because we believe the issues of gender and children's affairs, they are cross-cutting issues, and the state, His Excellency the President, is very much interested in them, and we are ready to move that right into a new trajectory. Thank you very much.
Thank you very, very much, Mr. Akwaka Ibindi Indoa, Deputy Minister, Social Welfare, Gender and Children's Affairs. And I also wish to acknowledge the presence of your Director of Gender, Mr. Charles Vandy. Thank you for such a comprehensive presentation, which I am sure gives all of us an idea of the progressive legislative steps taken by the Ministry for Gender and Children's Affairs. We believe, as an administration, that issues relating to women and children should be an integral part of our development thought processes, and that is exactly what informed the formulation of Cluster 5 in the medium-term National Development Plan. We believe as a country, as the distinguished Deputy Minister has said, we are catching up. We are catching up to make sure that we domesticate key international protocols like the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention on the Rights of the Child. All of those ones, once they are domesticated, we make sure that those ones will provide sufficient legislative and policy cover for issues relating to our children and our women. In countries like Rwanda, the Deputy Minister will tell you, they have a constitution 2003, which was revised in 2015. In their own constitution, in fact, they provided for minimum 30% representation for women. So for them, it's in the constitution. Here we are trying to do affirmative action to make sure that even though somebody was asking, say, if you get a country inside the woman and boku pass man, it's now they help the woman and back forget 30%. All they need to do is to just come together and bully us to men. So thank you very, very much. So let me at this point, before I bring in Frank Williams to give a few. Our cumulative confirmed positive cases for COVID-19 as of yesterday stood at 5,867. The epicenter of this pandemic continues to be the Western area. Western area, urban is accounting for 59% of the confirmed cases since March last year, followed by Western area rural with 16.3%, and then you have Kenema district with 2.9%, Potloko 2.6%, Bo 2.4%, and Bond 2%. So we have confirmed cases 5,867 as of yesterday. Our total deaths stand at 108, and we are aware we recorded 31 cases yesterday. In terms of the accumulation for past 7 days and the previous 7 days, so for the past 7 days, we have recorded a total of 292 cases, which we may wish to compare with 523 in the previous 7 days. So the previous 7 days, 523, the last 7 days, 292. So we have seen a 44% decrease in cases for the previous 7 days and the current 7 days, last 7 days. So 13 out of the 16 districts have recorded cases in the last 7 days. And as I said, from the 31 cases we recorded yesterday, they actually came from Western area urban, Western area rural, Potloko, Moyamba, Kenema, and Kailam districts. That's the 31 cases for yesterday. So for the last 7 days, 13 districts out of 16 have actually recorded cases. In terms of the treatment centers and care centers, current bed occupancy stands at 46%. So 46% of the current bed capacity is actually utilized. And I say current bed capacity because we're aware before the scaling down of the response, which actually meant in terms of bed capacity, we reduced some beds in some treatment centers and care centers because the case numbers were low then. So when I say bed capacity, it's actually in terms of the current bed capacity that we're using, which is around 488 or thereabout. So 46% of those beds are occupied in treatment centers and care centers. We continue to celebrate our health workers, to say big thank you to them, because even health workers in the course of addressing COVID-19 pandemic have also been infected. In fact, 4.4% of the cumulative confirmed cases is actually accounted for by health workers. So they also continue to suffer from this. Let's continue to have them in our prayers and in our best wishes. Vaccination is continuing all over the country. Government is making very frantic efforts to make sure that we augment the current stock that we have. Necessarily because the quantity for AstraZeneca was lower than the quantity for Sinopharm. It's what's not surprising that we seem to be having challenges. That number has depleted considerably. We only have few stock left for AstraZeneca, and for the few that we have, government's intention is to prioritize persons with underlying medical condition. So that explains why perhaps some people would go to some vaccination center to receive vaccination. If you're going for your first dose, that may be delayed a bit, and priority will be given to those who are supposed to take their second dose, and also persons with underlying medical condition. We still have a good number of Sinopharm vaccines which we continue to administer, and we want to continue to reiterate to the general public that these vaccines that are being rolled out have satisfied safety and efficacy requirements. They are validated by the World Health Organization, they were given emergency use authorization, and our pharmacy board, having looked at the clinical trials as well and the literature available, they believe that these vaccines are safe and they are effective for the purpose of administration. So we continue to count on you as our friends in the media and civil society to continue to diffuse the negative messaging around this, to please help us to address the misinformation and disinformation around this, and to ask our people to come out and be vaccinated. We would have learned, I'm sure we are now privy to the CDC risk assessment level 4 for about 54 countries as at yesterday, including Sierra Leone, and they are asking citizens of America who wish to travel to Sierra Leone to reconsider their travel and make sure they are fully vaccinated before they could come to Sierra Leone. The context is we are in the third wave. We are also having Delta variant. We have been very forthright with the public about how lethal and how intensive the third wave is and the Delta variant. We have spoken a lot about exponential rise in cases. We have spoken a lot about positivity rates, about increased hospitalization. 2 or 3 days ago, I did an interview on BBC where I also spoke about 70 to 80% of the beds at 34 and Agra Hospital occupied. So as a nation, we have been very forthright and transparent with the people of Sierra Leone. So when some of us were informed about the level 4 classification for Sierra Leone, in as much as we are concerned as a country because this will have implication for travels, but again, given the context and that it's not only Sierra Leone that is in this, we have quite a good number of countries who are currently classified under level 4. So we have countries like Sweden, Netherlands, UAE, Seychelles, even Rwanda, South Africa, Uganda, Liberia. Some of those countries fall under the 54 countries as at the 6th that are now under the level 4 classification. So what is level 4 classification? This is pretty much the classification for United Kingdom as well. So the first layer they would look at is what they call COVID-19 unknown, and they call that category COVID-19 unknown because some countries may not seem to be putting out sufficient data in the fight against coronavirus. So if you don't get statistics or you don't actually have a sense of the COVID-19 situation in that particular country, they would wish to classify it as a COVID-19 unknown. After that, you have level 1. Level 1 is when you say the COVID-19 situation in that country is low. And then you have level 2. Level 2 is when you have a sense that the COVID-19 situation in that country is moderate. And then you have level 3. Level 3 is when you say the COVID-19 situation is high. And level 4 is when you say the COVID-19 situation is very high. What that means is, advising your citizens, you may wish to say, okay, that particular country is level 1, so please exercise normal precautions if you are traveling to that country. For level 2, it means take increased caution if you are traveling to that country. Level 3, you are saying to your citizens, you may wish to reconsider your travel. And level 4, you are saying, please don't travel unless your travel is essential. If you wish to travel, make sure you are fully vaccinated. So if you look at the Centers for Disease Control and Prevention advisory for US, they are saying if you wish to travel to Sierra Leone, make sure you are fully vaccinated. And if you look at the third wave and the Delta variant, for a country like US, which has vaccinated in total 48 to 50% of their population, but for the adult population, they have vaccinated, I think, over 60% of the population. President Biden's ambition was to have vaccinated about 70% by July 4. That ambition has not been met, but they have vaccinated quite a good number of their people. UK has vaccinated also over 60% of their adults. EU generally, vaccination stands at around 25-30%. Africa is yet to go beyond 3% of vaccination. So this explains when people look at this situation, and this is why again I'm very passionate about this. We have to really work hard to call on our people to get vaccinated and diffuse any negative rumors, any negative messaging, misinformation and disinformation. Because this is Africa's struggle. If we are not careful, vaccination will become one of the important tools in diplomacy, and for countries like us, which are at the receiving end, will always suffer the brunt of some of these diplomatic endeavors. So let us, in our own endeavors as well, let's make sure we vaccinate and get our people also to come out and be vaccinated. Our business as a country is to make sure that we become extra vigilant and make sure that we comply with the measures. We are required to mask up fully, wash our hands with soap and clean water, or if you have the alcohol-based sanitizer, use it. We social distance, or we do physical distancing, but let's get vaccinated. That is important for all of us. I gave us the data for the previous 7 days, 523, which reduced to 292 in the last 7 days, which shows a significant decrease of 44%, which means the measures have the potential to work if we comply. Once we continue to abide by the measures, we will continue to see decrease in the numbers, and that should be able to inform those who are placing us on whatever levels to reconsider that position. Let me bring in Frank to talk to us about the scope of enforcement, and then we'll get questions from the press.
Thank you very much, Mr. Chairman. Good afternoon, all. Kindly permit me to do this short talk on existing protocols. Our job as enforcers for the regulations becomes easier when we get high cooperation from the public. It is very difficult when there are challenges from the public. To make our job easier, we have decided to go a little bit electronics. With the current situation, which is the curfew order that is in place, we have established an electronic system where the public can apply to get passes through the electronic system, and of course the portal is, or the link is, if we are interested, we can record this link. It's epass, one word, .covid19.com. epass.covid19.com. These passes will be issued to essential service workers, those who know that are supposed to be on the street. We issue to them. What we did in that direction, again, we have whitelisted some institutions or essential service workers. They know exactly the vehicles that are supposed to ply the streets during curfew, and they have the liberty to issue those passes to the vehicle. We have increased the checkpoints within Freetown and the country at large, with increased personnel deployed at those places. I must hasten to say that these personnel have checker phones. They will use those checker phones to ascertain the validity of your passcode. If you are not supposed to be out, they will keep you, you will spend the night with them, and maybe they will release you in the morning. There are also night patrols to ensure we reduce the presence of people on the streets. Night hall checkpoints are up and running. We are also issuing security clearance for funerals, weddings, and other social events, with a specific caveat to it, provided you are ready to keep your audience to 50. We are monitoring the access of persons to public buildings with the availability of vaccine cards. We may not be everywhere at the same time because we have schedules through which we work. We rely wholly and solely on the media to help take the message to the general public. Once more, I want to thank you all.
Now it's time for question time, and we request that, as usual, tell us your name, the media institution you're coming from, and who the question is directed to. So it's now open for questions, please. We have the mobile microphone. If you have the microphone in front of you, just press and then ask your questions. Yeah, members of the fourth estate, I will accommodate a few questions if I see no question. There is a microphone just by you. Just press that mic and proceed to your question. Press the mic, please.
Thank you very much. Monica is my name. I write for our newspaper. Deputy Minister, thank you for the update, and you made mention of a lot of achievements and steps. I'm concerned, one, with the strategy on national state child strategy or policy you are about to develop. My concern here is how many children are we talking about that are on the streets? That's one. And two, the Women Empowerment Fund, the female entrepreneurship, that is laudable strike, funded by government and Spanish through the ECOWAS. But I mean, how much are we talking about? The project has already been implemented. The value for money, how much are we talking about? Thank you.
Yes.
Vincent Chalimo, New Vision newspaper. This question has been for, the first two questions have been for Nagowa. My observation within the capital city, particularly the eastern part of the city, the enforcement level, I've seen it very, very low compared to the other, compared to last year. Let me say, compared to last year, because presently you can see public transport be pack up, jam up, and we are talking about the third wave. Taxis are taking 3 passengers in front of police and the like. Nothing happened. We are still talking about third wave. Then to my Deputy Minister of Gender, in the just concluded presidential debate in Parliament, one of the MPs from Kono district raised this concern about the OneStop Center. She said it's not effectively operating. She even recommended that they empower the other institution, I think it's other institution instead of the OneStop Center, because he said in Kono district and other parts of the country, the OneStop Center is not operating. I will stop here for now.
All right. Somebody else?
Yeah. I'm Don Stansko. I write for the Newstorm newspaper. this is for Nakova. I was in the Northwest region recently, and I came to realize that very little awareness or sensitization is being done with regard the fourth wave of this deadly virus. And I want to know why the Northwest region, specifically Boloko, was not considered in terms of intense awareness raising with regards the corona.
Okay, let's still wait more before the response.
Mohamed Kumara. My first question is for the Deputy Minister of Gender and Children Affairs. To the best, the last time I attended a press conference at the National Commission for Children at the Street, we were told that there were about 22,000 children out there in the streets. You've not told us about how your collaboration with NACOVAC and this horrific period of COVID-19. And if you can remember, sir, to the best of my knowledge, you got thousands of women more from Freetown to Waterloo without absolutely no protection, no mask, no nothing. What is your role in the protection of thousands of children out there in the streets in this horrific period of COVID-19? To the Deputy Minister of Information again, sir, it seems to me that phase one, as you call it, of this COVID-19, what is the difference between phase one of COVID-19 and phase 3 of COVID-19 in terms of the confirmed cases? Because we seem to be escalating again.
All right, thanks very much. Let's hold it there for now. We'll come to the next round. Let's allow the ministers as well as NACOVAC to respond. Probably we'll begin with the Minister from Social Welfare. Gender.
Thank you very much, Mr. Kalon from our co-Vicent. Mr. Kalon, the questions are in twofold. I think one on the policy aspect for us, and then the other one, the technical aspect, Director Van will take care of that. Well, like I told you, that as a ministry, we are now developing a strategy. If you look at the PowerPoint presentation about the street children. And so, when you're developing a strategy, you have to look at other issues. Like you were saying, our staff, they are now working with other child-friendly centers. Then we see how best we can go between Waterloo, like you were saying, the other man, I'm just encapsulating all of the question that has to do with the policy aspect. And then Mr. Bandi will take the details of what are really embedded in the strategy. So the policy we have formulated, we have given them the directives at our level, both minister and deputy, and now they are working on the strategy. So this strategy is now entails how many children, where are they going to demarcate them as a cluster? Do we have Western area or central business district? But what we is saying, we as the leadership, we have designed a strategy because we believe that we do not want to see any Sierra Leonean child in the streets. So that's one part. Mr. Vandy will take the detail. Exactly, you're saying on our management meetings, we've discussed the COVID because when the ministry was gender, social welfare, they dealt with the Ebola. So we know what it means for our kids, how to manage the situation at a period like this, especially when we're talking about the third wave, which is the Delta. So we have started looking at them. We have had meetings yesterday. The National Commission for Children, they were in my office because I am the supervisory deputy minister in charge of them. So they are going to do their proposals, and by the next management meeting, we'll look at it. So Mr. Bandi, look at the strategy and the details. Thank you.
Thank you very much, Deputy Minister. On the strategy for street children, it is basically going to look at, we have to understand the dynamics that there are children who are permanently living on the streets, and there are those when they have some issues with their caregivers or parents, they hit the streets and then get back. What we want to do is to ensure that we contribute as a ministry to the free quality education
Because if you even see the street beggars on the streets, there are children accompanying them, and these children are deprived. So what we are going to do is we are going to have awareness raising, sensitization. We are also going to have what we call drop-in centers, so that once we identify, like last week we had a child, and that child is from the provinces. So we now do family tracing and reunification, so that the best place for a child to be is with their parents or their caregivers. And then we can get them back to their parents and ensure that they get schooling. So the strategy is going to be very encompassing, and there is a follow-up mechanism to see that these children who are being placed back are not getting back to the streets again. The other question that dealt with the women's empowerment, the business incubator for African women entrepreneurs, the BIAWI project in Bo, is quite a success. And what we did in that project, somebody was asking about the quantum of money involved. It was 125,000 euro for a pilot project, and 2 countries were selected, Sierra Leone and Burkina Faso. And one of our staff, who was the project coordinator, which I supervise directly, is leaving Senegal today, and the feedback is between Sierra Leone and Burkina Faso, Sierra Leone had done well than Burkina Faso amidst all of these challenges. So that is also good news for Sierra Leone, and it's targeting 200 women. What we did, we also worked with Apex Bank. We had a memorandum of understanding with them, so that the credit guarantee out of that 125,000 euro, 50,000 euro was set aside to ensure that women have loans. If the normal bank rate is at 22%, those women got it for 10%. They are now on their second recovery payments, so that once we recover those monies, we can now expand the scale. The other thing also is they prioritize what they wanted to embark on. It's in 6 districts, in both districts. They wanted to look at cassava processing, rice processing. They are looking at animal husbandry, and they are also looking at palm oil processing. If you improve on the quality of palm oil, you can also make more money. So the machines and gadgets are all fixed. If you visit Bo, ask for we have a center in Bo, very close to the limits, and all of those equipments and gadgets are there. The project team is there. What we are now working on is sustainability. We want as a ministry to hand over that facility to the district council, so that they can now move along with it, and we do the coordination and monitoring, so that we are no longer at the face of that project. The one you mentioned about in relation to the OneStop Center, I had discussion with Rebecca Kamara that's actually made, but her submission was to ensure, she was very happy about government setting up the OneStop Centers. She was advocating for increased resources to get them work well. I had a lengthy discussion with her last week, and Konon do not have a one-stop center. Konon has a Rainbow Center. So what we did in all of this, Rainbow, we have a memorandum of understanding with them. In districts where Rainbow Centers are not present, those are the districts where we place the one-stop centers in the government hospitals, so that they increase service provision. You get to the one-stop center, a police officer is called to take statements. So the burden of you moving from FSU station, going to the hospital, you are referred again to another location, is all reduced. We are not oblivious of the fact that there may be challenges. But the good thing is, we are now learning from those lessons. 2 weeks ago, I was in the provinces, looking at the Rainbow Centers and also the one-stop centers. We acknowledge the challenges. We can only get them better as we go along. But that is the situation where we are. And a lot of people, before now you get to the government hospital, you don't know who to talk to, and you don't want the confidentiality also to be disclosed to people. I mean, but now you go to the hospital, one-stop center, you can get all of your services for free. And we are working closely with the Ministry of Health and Sanitation. They have the medics. We are also providing psychosocial counseling. And where challenges are not abound, we even provide them transportation reforms to get back. Because for people to come to the center and get back, like they were explaining to us in Moyamba, people move from places where they have to take motorcycles for over 100,000 years. How do they come? So compromises are even happening before they get to the centers. So these are all challenges that we are looking at. For, like the Deputy Minister stated, during Ebola, no child got missing. There were even children who were taken to treatment centers. Some from the north were taken to the south in Bo for treatment. But at the end of the day, we were able to do family tracing and reunification, and all of them were actually brought back. So the PSS pillar, which social welfare is dealing with, are an integral part of that pillar. So we are working with them, and we will ensure also that the situation we find ourselves, we work with the other child protection institutions like the schools, the MDSSE, just to ensure that school safety, all of those children are safe. But we'll take heed to your observation as those kids flying through the Waterloo for us to see. We have stated that children, their movement needs to be minimized except for schooling, which we know some of them are now on exams. After exams, I think they should be at home and let the parents who can take better caution be on the streets to fend for the families. So that is where we are at the moment. I hope I have answered some of the technical questions that were posed in relation to the Ministry of Gender and Children's Affairs. Thank you.
Let's move down to the NACOVA.
Thank you very much. So on COVID, we clearly see the need to have sustained risk communication and social mobilization. In any given pandemic, or what you may wish to call an outbreak globally, risk communication takes place before, during, and after. So it's something that you sustain over a long period of time. We believe that we will continue to do this, to continue engaging communities, because community engagement is a very key feature of risk communication. In the DICOVAX that I established countrywide, the risk communication and social mobilization pillar is in those DICOVAX. For the third wave of the pandemic, asking about the fundamental difference. The fundamental difference is the peaks of the cases. So you will find out that the peak of the second wave may have been slightly higher than the first wave, but the peak of the third wave is significantly higher. The rise is quite exponential. What is troubling about the third wave is the variants of concern. So in our own situation, we detected the Delta variant, which is linked to what was the variant that was detected in India. In some other countries in Africa, you have the Beta, which is the variant that was linked to South Africa. And then in some other countries, you have the Alpha, which is the variant pretty much detected in Europe and other places. So countries that have seen these variants of concern have realized that their cases in terms of spikes grew exponentially. So where in the first and in the second wave, one person who was infected was capable of infecting 2 or 3 more. For the third wave, it could be, the third wave, they say the transmission, the transmissibility is between 65 to 85%. So you take that 2 to 3 infections per person, and then you now take 65–85% of that. So it gives you an idea that for the third wave, it's higher. So in our messaging, you know, but in our messaging, we've tried as best as possible to simplify this, and we tell people this Delta variant we don't come, this new virus we don't come, you know, case don't want, not to joke, not to play, and all of that. I would assure you that across Sierra Leone, communication around the third wave and the pandemic generally is going on. So you asked about Northwest, and Northwest is where we have Potloko, Cambia, Caribbean. Yes. So Potloko now is 2. Potoko is accounting for 2.6% of the cumulative confirmed cases. Gambia has less, and of course the two lowest are Falaba and Karine. In all of those districts, we have communication and social mobilization going on in collaboration with local and international partners. Of course, Potoko, one of the strategic advisors in the response, Honorable Alhaji Alpha Khan, is doing pretty much there. He continues to engage. Every weekend he's there. Most of the time during the week he's there as well, supporting the response. But what we have to acknowledge is, in a pandemic, you have to sustain messaging around it. And for Sierra Leone, the uphill task, let me just lay the context. We went through the first wave, and for the second wave especially, we brought in quite a good number of tight restrictions. Once the state of public emergency lapsed in March, government did not see the need to extend it further. And once the public emergency lapsed, the restriction on movement also lapsed. And then that was also about the time we had rationalized the workforce. We scaled down because the epidemiological data was suggesting that a lot of districts had gone for more incubation periods without recording a case. We scaled down on our bed capacity because we were not admitting people. And generally, we had managed COVID-19 cases. So it did not make fiscal sense to continue retaining that kind of workforce. So we scaled down. So I am sure Sierra Leoneans looked at all of those variables, and someone just concludes, we see they don't pull all their restrictions, COVID don't do. So we now have the task to recalibrate. So how do you succeed to persuade people when they look at the case numbers, sometimes it's in a 3 case, 4 case? Some people will just look at the population and say Sierra Leone is 7.5 or 7.8 million. If you get 3, 4 cases, go to Betet. Some people will look at how the death rate stagnated for a period of time, and so if people are not die well. So some people were even saying, Corona not this alone. Now other place than is sick again. So we have all of that uphill task, but we want to assure Sierra Leoneans that I think what will make it easier for all of us, if all of us are in this together. But if we just say this is government responsibility, then it becomes extremely difficult. So we'll continue to do this. So that is really the fundamental difference between wave 1, wave 2, and wave 3. And for this third wave now and with the Delta, even America that has vaccinated so much, they have detected Delta in all the 50 states. And 32 states in America have seen case surge again. You know, even in the UK, it's all over. In Africa, it's all over. So it appears, as the World Health Organization has alerted, it appears the third wave is more virulent than the first and second wave. And I think what explains it in part is the emerging variants of concern. You know, but our best bet really is to do a lot of vaccination and get people to face masks and get